I'll start with the prayer. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Parabrahma, Tasmain Sri Gurave Namaha, Tasmain Sri Gurave Namaha. With due respect to Swami Kepalabhati, Swami Maheshananji, O.P. Tiwari sir, and all the stalwarts in yogic field all over the world who are attending this seminar. Namaste to everybody. I'm going to talk on ongoing research studies at Kaivalyadham. Swamiji initiated the scientific research in yoga as early as in 1924. His findings on Nauli, Pranayama, and meditation are still unchallenged thanks to his passion for fundamental research in yoga. I'm happy to share most recent research findings as well as ongoing research at the Scientific Research Department of Kaivalyadham. The first project is effect of yoga and relevant training on averting symptoms of diabetes type 2 and its correlation with gene expression. It's a prospective outcome randomized control study. It is funded by EMR AYUSH of Government of India. It is in collaboration with Genome Biotechnologies Private Limited. 21st century is a century of tension. The non-communicable diseases are on rise, particularly diabetes. By 2030, it is said that India will be the diabetic hub. Every fifth Indian will be diabetic. The survey was done in 2014 and it was found that 66% of the people are in pre-diabetic range. Diabetes is one disease which has got effect on all organs of the body. If it affects retina, retinopathy, there is a blood vision. If it affects coronary arteries, there is myocardial infarction. If it affects kidney, he has to undergo dialysis. If it affects the blood vessels and nerves, patient gets gangrene. So it is called a silent killer also. Now modern science has studied genetic studies and they have identified predisposing genes in diabetes. And yogic research all over the world, it has proved that yoga can help in diabetes. If you practice yoga, you can keep yourself healthy, diabetes free. And if it is a recent origin, you can revert back to normal. And those who are having diabetes, they can arrest the progress of disease and control the medicinal dose and complications. Now, in view of these observations, we are studying the effect of yoga in pre-diabetic population at biochemical and gene expression level, which is not studied by any other institute in the past. Now, the highlights of this outcome of project, it is a significant improvement will be seen in glycemic control, body anthropometry, blood pressure, lipid profiles, insulin resistance, secretion, and we'll be able to understand the effect of yoga on individual on gene expression studies. Now in this, we have identified or we have scrutinized the pre-diabetic patient by biochemical tests, by doing fasting blood sugar, postprandial and HbA1c, and we have confirmed it by doing genetic predisposition analysis, and then we have categorized them into two groups, control and experimental, and 30 each. And in that also, we have taken high risk and low risk depending upon how many gene predispositions are seen. Now these people, they were selected. Then first baseline blood testing was done, which was for biochemical parameters, gene expression level, then self-report instruments and additional data. After that, they were given 3 months of active yoga intervention. At the end of 3 months, their blood testing was done. Then 3 months passive intervention was given. And after passive intervention, again blood testing was done. And all these parameters will be tested and data analysis will be done so that we can come to the conclusion that whether diabetes yoga is only having effect at biochemical level, also at gene level. Because if the gene expression levels changes, then patient can have sustained effect. And if you tell the pre-diabetic, you can practice this yoga so that you can avoid the diabetes in your future life. The status of the project at present, we have finished the active yoga intervention and we are waiting for the passive intervention to be get over, and then we'll do analysis and the results will be seen. The second project is the effect of yoga on physical and emotional health of infertile women with polycystic ovarian syndrome. It is funded by the DST, Department of Science and Technology of Government of India. It is in collaboration with National Institute of Research and Reproductive Health. Now, PCOS, polycystic ovarian syndrome, is an emerging health problem of national concern all over. They're ranging from 2.2 to 26% incidence. More than 60% women with PCOS are obese and they need lifestyle intervention. There is increased risk of development of infertility, impaired glucose tolerance, diabetes, dyslipidemia, hypertension, atherosclerosis, and endometrial cancer. There is a high prevalence of anxiety, depression, disorders, and suicidal tendencies. Now, we took up this study as there is no published research studies on the effect of yoga on physical and emotional well-being among infertile women with PCOS. Intervention phase has been completed and we are on the process of data analysis and results will be coming in soon. The third project is the effect of Kapalabhati using heart rate variability. Now, researchers have examined the effect of emotions on the autonomic nervous system by analysis of the heart rate variability. This balance between the effect of sympathetic nervous system and the parasympathetic nervous system is known as the sympathetico-vagal balance and is believed to be echoed in the beat-to-beat changes of the cardiac cycle. The objective of this work was to find out whether Kapalabhati helps in reducing stress. Initially, the subjects were given stressful tasks. The low frequency, high frequency ratio was very high, which was indicating that sympathetic activity is more and there is a lot of stress. Then they were given Kapalabhati, the stress has reduced. Then finally, we, after the Kriya, again saw the LFHF ratio has come down. The final results indicated that Kapalabhati helps in reducing the stress among humans. Now, this is the graph showing the low frequency, high frequency ratio. It is very high, indicating the sympathetic activity. During the Kapalabhati, it has come down to so much, and after finishing Kapalabhati, it has come to so much less. And the person was completely cool and calm. Now I'm talking about the Collaborative Research Center, which has been awarded by CCRYN, Government of India, and we are supposed to do 3 projects per year. I'm going to discuss one by one. The effect of classical Kapalabhati Kriya on the total antioxidant status and pulmonary functions of healthy individuals, a self-as control pilot study. Here, the objective is to assess the effect of Kapalabhati Kriya on the total antioxidant status, on pulmonary function, on the reactive oxygen species, and to assess the effect of retraining also. The parameters were antioxidant status, ROS, superoxide dismutase, glutathione, and pulmonary function test. Now the design was self-patch control with repeated measures design. Here we have selected 40 participants. So first baseline testing was done, that was T0. Then after 40 days, so it acts as a self-patch control. Then we gave 40 days Kapalabhati intervention 2 times. So 0 to 40 control, 40 to 80 first intervention, 80 to 120 second intervention, and then retraining after 120 to 160 days. And at all end of the 40, 80, 120 and 160, we have done all the tests and then we are going to analyze the data. The outcome of the study may be applicable as follows: to help avoid the ill effects of oxidative stress in healthy individuals, to deal with pulmonary disorders at a pre-pathogenic phase, to maintain the healthy functioning of the respiratory system. Next project is the effect of Agnisara Kriya on insulin resistance and insulin sensitivity in pre-diabetic population. To assess the effect of Agnisara, it is on insulin resistance, insulin sensitivity, and to assess the detraining effect of Agnisara on insulin resistance and insulin sensitivity. The sample size was 80, experimental 40, and control 40. The parameters selected were this. Yoga intervention was given for 5 rounds of each 20 movements of Agnisara, 5 days a week for 3 months. The project outcome was the study may be applicable to persons detected with prediabetes, and initially only I told that 66% of the people at present they are in the pre-diabetic range. It will help to improve the mechanism of insulin resistance and insensitivity. It will prevent or delay the onset diabetes mellitus and its complication. Next project is the effect of Trataka Kriya on stress, anxiety, mental well-being in mothers of pre-SSC students. Nowadays, the students of 9th and 10th standard, they don't have much tension. But the tension more is borne by the parents, particularly mothers, and they are under stress. So we have selected this topic to assess the efficacy of Trataka Kriya on stress, anxiety, and mental well-being in mothers of pre-SSC students. The sample size we have taken 100, 50 experimental, 50 is control, and total intervention will be of 3 months intervention, 3 months detraining. In that, we will be giving them thrice a week Trataka. Such 3 months we will be giving them. The outcome we expect that will help to reduce the parental anxiety and perceived stress. It will increase the mental well-being, the quality of sleep, and generalized anxiety. The next year CRC projects, I'm just giving those are in pipeline, is the effect of yoga module on migraine and effect of Shitali in hypertension. We have done instant study of effect of Shitali on students of our college, and we found that 20 times practicing Shitali reduced the blood pressure, systolic by around 5 to 6 beats and diastolic by 20 beats. So we are going to take this study on a larger scale. Next project is the comparative effects of Shawasana and yoga meditation on biophase angle, resting metabolic rate, and emotional intelligence. These 3 groups were made, each of 32 students, Shawasana group, meditation group, and control group. The parameters were chosen to see their effects on biophase angle, RMR, and emotional intelligence. 42 days were the intervention period and 42 days were the detraining period. The results were biophase angle meditation group showed a superior effect. Resting metabolic rate, a non-significant increase in meditation group, little less energy expenditure in Shavasana. Emotional intelligence, sustained self-awareness was evident more in meditation than Shavasana. Self-control, it was enhanced in meditation group, while in Shavasana group, it decreased significantly. Motivation, it increased significantly in meditation than in Shavasana. Empathy, in both the groups, empathy was enhanced marginally. Social skills got enhanced marginally in meditation group as against a decreased one in Shavasana group. Composite emotional intelligence showed medical groups, the meditation group showed a more sustained effect as compared to the Shavasana and control groups. These are the graphical results which have been shown here. I'm just passing it. Next project is yoga for inflammatory cytokines. The objective was to assess the effect of yoga practices on lipid profile and different cytokines. All the participants were assessed for lipid profile on all these cytokines at the baseline and at the completion of 3 months of yogic practices. The results were shown that significant changes in cholesterol, LDL, HDL, and cytokines. A yoga-based lifestyle intervention seems to be a highly promising alternative therapy which favorably alters inflammatory markers and metabolic risk factors. Next project was yoga for micronutrient absorption. The objective was to find out the effect of yoga on micronutrient absorption in urban residential school children. 66 students were selected and 2 groups were made of 33 each, and the following tests were performed, and the conclusion results were there. The experimental group showed significant improvement in micronutrient absorption as compared to control group. So this indicates that yoga practices could improve micronutrient absorption in urban residential school children. Next project is yoga for general mental ability. The objective was to assess the effect of yoga on general mental ability of urban residential school children. 66 students were selected and divided into 2 groups, and they were given yoga practices. The results shown that experimental group showed significant improvement in general mental ability as compared to control group. The conclusion, the findings of this study indicate that yoga practices could improve general mental ability of urban residential school children. Next project is efficacy of simple BHRAMARI pranayama on sleep quality and psychological well-being in hypertensive patients. The sample size was of 40 hypertensive patients in the age of 30 to 60. The expected outcome in this is it will throw some light on the effect of BHRAMARI pranayama on certain associated symptoms of hypertensive patient. In this study, we propose to see the effect of simple BHRAMARI pranayama on sleep quality as well as the psychological well-being in hypertensive patients. Next project was effect of yoga training on body shape index among residential obese subjects. To test effect of yoga practices on body surface area and body shape index, yoga practices decreases surface body shape area and increase the body shape index. The results were there was a non-significant decrease in body surface area, but enhanced body shape index. So conclusion was that study concludes that yoga practice leads to reduction in body fat distribution and decreased body surface area. It has been seen that yoga practices increases body shape index due to fat mobilization. The next project was the effect of yoga module on pro-inflammatory and anti-inflammatory cytokines in industrial workers of Lonavala. Normally, when there is infection, viral or bacterial, the cell produces pro-inflammatory cytokines, and anti-inflammatory cytokines are produced by the cell in a normal procedure. So when the balance between the pro-inflammatory and anti-inflammatory cytokines is disturbed, there is a disease. So if person is practicing yoga, the anti-inflammatory cytokine level is definitely high, and usually he will not get repeated infection. And this has been seen by giving yogic practices. It has shown that decrease in the pro-inflammatory cytokines and increase in the anti-inflammatory cytokines in the industrial workers, so that they keep themselves healthy. Neti Kriya as a therapeutic intervention for chronic allergic rhinitis was a single case study done. The aim of this project to see the effect of Neti Kriya on chronic allergic rhinitis. The objective was to assess the effect of Neti Kriya on self-reported rhinoconjunctivitis quality of life questionnaire, to study the qualitative impact of the treatment on the patient's life with the help of semi-structured interview questionnaire, and to assess the effect of Neti Kriya on absolute eosinophil count of the patient, which is the marker seen in the inflammation. The results were very good. Post-intervention patient appears asymptomatic and with improved domain of all the psychological tests and reduced absolute eosinophil count. So conclusion, this study is definitely beneficial for rhinitis patient. This is the graph which is showing the different activities, how it was helpful. Next was the immediate effect of BHRAMARI on blood pressure, pulse rate, and in hypertensive and normotensive individuals. The study effect of BHRAMARI pranayama on blood pressure, and it has found that it will improve the vagal tone of the practitioners and thereby help practitioners in keeping the levels of systolic and diastolic blood pressures under control. The next project was role of yoga in self-regulation, a cross-cultural study of Indian and Spanish samples. It was to propose the study S-ART model, which consists of self-awareness, self-regulation, and self-transcendence as a framework to explain the mechanism of action in yoga practice, to provide preliminary evidence of these mechanisms of action of yoga practice in practitioners and non-practitioners from Indian and Spanish samples. The results indicated a significant improvement in self-awareness and self-regulation and tendency to be more compassionate in both Indian and Spanish practitioners. The study has helped to understand the psychological mechanism of action of yoga practice in a cross-cultural sample of yoga practitioners. The next project was the psychological impact of a comprehensive yoga model in cancer and chronic non-communicable diseases. It was an empirical study. It examined the psychological impact over a period of 1 year in terms of quality of life, perceived stress, coping, depression, anxiety, mood, and mental state of a 3-week intensive residential yoga retreat on patients suffering from cancer and other chronic non-communicable diseases. The results revealed that complementary treatments with focus on yoga therapy have tremendous potential in bringing holistic health and psychological empowerment to people suffering from non-communicable diseases. The next project, a complementary alternative medical therapy for breast cancer-related lymphedema, a pilot study on the influence of an improved yoga protocol. To implement an improved yoga protocol as a self-management tool for breast cancer-related lymphedema patients taking treatment at a defense hospital in Western India, the results were encouraging. It showed that they indicated a positive trend in yoga's contribution to self-management in the area of arm volume and functionality. Improvement in tumor necrosis factor, TNF alpha, was also seen. This is a case report of fibromyalgia. Fibromyalgia is a rheumatologic syndrome leading to increased pain, sensitivity, sleep disturbance, fatigue, stiffness, and tenderness of joints, muscles, and tendons due to dysregulation of neurophysiological functions. This lady was a 42-year-old with no smoking, non-alcoholic, and having all these symptoms, and it was confirmed by ruling out all other causes of these symptoms. And the treatment was given. There was no concomitant allopathic treatment was given. The patient was given daily yoga practices, 1 hour, 6 days a week, in the morning and in the evening for 9 months. And the muscle fatigue, quality of life, and sleep was assessed at the baseline, 3rd month, 6th month, and the 9th month. And it was found that reduction in the muscle fatigue and improvement in quality of life and sleep. Next project was effect of yoga training on psychophysiological health of yoga students, a survey study. Here we study the short-term and long-term effect of yoga on psychophysiological health of students. We have given yoga intervention to about 300 yoga students who are joining the KAIVALYADHAMA college. The results, they have shown the positively improved the participants' psychophysiological health. Next was the effect of yoga, Ayurveda, and naturopathy on the participants of KAIVALYADHAM'S Hospital and Healthcare Center. Here we study the effectiveness of the therapy treatment given to the various types of health conditions by the implementation of yoga, naturopathy, and Ayurveda in hospital. It is an ongoing process. Every week, minimum 2 participants are tested, and the results of beneficial effects of yoga, naturopathy, and Ayurveda therapies for patients with various health conditions. These programs are found to be very helpful to reduce the stress levels also. The future projects, which have been just prepared and we are going to submit it for funding agencies. The first is the biochemical and biomechanical exploration of effect of yoga in low back pain. It is in collaboration with MGM School of Physiotherapy, MGM Institute of Health Sciences, DIM University, Navi Mumbai. We are going to submit in AYUSH EMR scheme. Now, objectives in this, biomechanical evaluation of yogasanas to provide understanding of joint kinetics, and muscle activity. Biochemical evaluation of antioxidant activity to evaluate the effect of stress in low back pain. Comparison of yoga intervention with conventional physiotherapy exercise protocol for low back pain. The biomechanical evaluation of the yogasana will be done in this. These are the devices they are using in the physiotherapy college. The expected outcome, to prepare manual describing biomechanical demands during yoga asanas in people with low back pain. It will also help to give safe prescription of yoga to people with compromised musculo-skeletal function. Research outcome from proposed study will help us integrate yoga into health promotion programs for urban and rural people of India. Second project is effect of yoga on obesity. This is also we are submitting to the EMR scheme. It is in collaboration with National Institute of Research and Reproductive Health. The objectives are to assess the status of lipid profile, pulmonary function, body mass index. Here we are using DEXA body scan so that it will be more authentic. Mental efficiency, quality of life, and well-being in obese person. Again, we are going to see effect on eating habits, behavioral, anthropometric measurements on level of adipokines, on the quality of life, and to study the impact of weight loss. Here we are going to make 3 groups. One group will be given obesity management with yoga, including mindfulness-based stress reduction MBSR program. Second group will be given obesity management with yoga only. Third group will be given obesity management with meditation only. All the participants in the three groups will have to undergo brisk walking for 45 minutes, 5 days a week. Now the parameters used in this are these. Only important I have to mention is the DEXA scan. Expected outcome. The main outcome is to study the effect of yoga meditation alone or yoga with mindfulness-based stress reduction MBSR on the following: whether there is any change in body weight and BMI, change in anthropometry, change in serum lipids and other parameters, change in biochemical tests, then percent change in bone mineral density, and changes noted by psychological testing. Next was the effect of modified yogic practices and meditation on psychological, musculo-skeletal, cardiopulmonary variables and sport-specific skills in wheelchair-bound area para basketball players. It is in collaboration with the Department of Physical Education, University of Mumbai. Now these are the paraplegic patients. Because of the injury into the spinal cord at the back, they are not able to make movements of the leg or below the umbilicus, and they are all the time wheelchair bound, and that is why they are depressed. So objective of this study to improve the physical ability, to reduce the feeling of isolation, to enhance the mental ability, to improve the physiological function of lung capacity, and to encourage restful sleep, and to improve the implement yoga as an integral component in the day-to-day practice of these people. Expected results, we are expecting good results, changes in psychological variables like quality of life, musculoskeletal variables, cardiopulmonary variables, and further meditation will improve the mind frame to help the players feel them secure and develop an overall sense of well-being. The next is the effects of yoga on selected psychological parameters in new entrants of professional college. It is in collaboration with SSN College of Engineering, Chennai. Now the boys coming for professional college, they are coming from different area, maybe from rural area, maybe from vernacular language, and usually they develop inferior complex because of the coming into the cities. And because of that, they get indulged into the bad habits like drinking, smoking, going into a bad depression space, and may have suicidal tendency. We quite often read into the paper that some student from professional college has committed suicide. So we have taken this project because several studies have shown yoga helps in promotion of positive health, including mental health, and yoga will help in cognitive functions and psychological health. It will give them a moral boost so as to help them to complete the degree course successfully. The objectives to employ non-invasive EEG sensor and Fitbit smartwatch to collect various data from them during different intervals. Here, 8-channel EEG is used here for collecting the brain signals. Thank you. These are the projects ongoing and in future which we are going to do in Kaivalyadham in the Scientific Research Department. Thank you very much. Namaste all. Hari Om.